Now, coming to the medical side of things. So let's say person X had these symptoms. He's fine now, but he comes to me, or maybe he goes to some other doctor. So what do? We need to follow protocol. So we may try and understand the situation first, and in our wisdom, we may feel that it was not an ongoing heart attack. But it doesn't cost us much to do an ECG and cardiac troponins. So when should this be done? Almost immediately, as soon as the person is relaxed. You can't wait till the next day. So once the person is relaxed, okay, you can give aspirin, Dispirin. Aspirin is also, if you have a doctor, because that's not going to hurt. Okay, it's better to keep a blood pressure machine at the workplace, so that you can continuously monitor the blood pressure and heart rate, and relax the person. You'll see the blood pressure and heart rate coming down. So by the time he reaches medical care, which means when he's on the way, you have enough time to relax him. Calling an ambulance, waiting for an ambulance, well, if it is accessible and nearby, it's fine. But if it's not, take the earliest vehicle that you get and drive him to a medical facility that has the provisions to rule out a heart attack. So if you go to the nearest local doctor, it's again a waste of time. Because he doesn't have anything other than the Dispirin that you gave him, that you've already given him, to either diagnose or even figure out what's going on. So
we should go to a hospital where they have a
facility. They have an emergency facility.
So carrying out ECG
and other things. Yes. So you go straight to the emergency and they have a ready protocol where they will immediately do the ECGs. They will take the blood for something called cardiac troponins. That is the earliest marker that we look for an ongoing heart attack. ECG, cardiac troponins, and of course they will do blood sugar, because many a times people leave their workplaces early in the morning, they have not had their breakfast, they come, they hit their desk and they begin their work, and it could be a low sugar that was mimicking a heart attack. So all this can be done in 20 minutes of someone complaining of these symptoms, and you don't have to rush through it. This can be done in a very smooth and calm manner. If people are screaming, yelling, hey, call that, call this, that is again going to precipitate, because now this person is going to think that there is something actually going on with him when he sees the behavior of people around him. So in any crisis situation, everybody trying to manage the crisis also should ensure that they have a calm demeanor and posture. That gives confidence to the person you're going to take care of. So now, when someone comes to the medical facility, you get his ECG done, cardiac troponins, and you get his blood sugar done. So this will rule out any acute event happening. But still, it is quite possible that the blood markers, especially the troponins that I spoke about, and ECG changes may take some time. So if this person has had something just 20 minutes prior, it is quite likely that he may take time to manifest these changes on the test. If suppose it was something that started at 7 a.m. in the morning, and he just brought it up when it became very severe at 9 a.m., then it's very likely he will pick it up. So if it is something that just started, it's still likely that it may be missed. So it is essential, and so when doctors will say everything is clear, but we need to keep him for monitoring, that's when the questions come up again. As to why do you want to keep him if everything is fine? So the doubts come in the patient's minds as well as the caregivers. I mean the person who has brought him to the healthcare facility. They have doubts whether this is now something else, whether the doctor is trying to take advantage of the situation. No. At least 6 to 12 hours, the person needs to be under close monitoring. where the doctors can either put him on a continuous ECG, they can check these markers once again. Most of these hospitals have an in-hospital facility to look for these markers. They have an in-hospital lab. So that's the best place for him for the next 6 to 12 hours. Because there have been cases where people have been cleared of any ongoing issue. They've gone back home and got an attack. That was the second attack that happened. The first attack went unpicked because it was early when they went home. So there was no primary care given because it was felt that this is nothing, just anxiety. Also was sent back and there they get a much more severe attack. Very important for close monitoring in a healthcare facility for at least 6 to 12 hours following such an event.